My name is Sam Meisler, and I'm a small animal veterinarian. In this segment, let's talk about dog fever, or fever in dogs. When your dog has a fever, which is defined as an elevated temperature, dogs normally will carry a temperature up to about a 101.5 degrees Fahrenheit. When you get above that, when we're right in that range, just a little bit above that, depends on, if your dog came into the veterinary clinic real excited or running around, and the temperature might go up a little bit. But when we get up into the 102.5, 103 range, that's starting to be a definite fever. Now, what can be the cause of a dog fever? Directly, the cause is some sort of inflammation going on inside your dog, somewhere in your dog, that's causing a systemic response, a systemic fever response, where the body is resetting what we call the set point, the reference temperature set point that your dog wants to be at, and resetting it up to a higher level, and your dog's temperature migrates up to that level. Now, most of the time that's caused by some sort of inflammation, and inflammation is caused in turn most of the time by some sort of infection going on. But there are other things that can cause inflammation. And the top on the list is a lot of cancers can cause inflammation. And so we usually think about, with a dog's fever, some sort of infection going on by bacteria, fungus, or other organism. There are diseases that are not quite a bacteria, not quite a virus, that will cause things like Lyme's disease. Of course, viruses can cause inflammation and cause a fever. So those are primarily the causes, but we still need to think about possibility of cancer somewhere in the system. And that's the sort of big scary one that raises its ugly head. Usually when I'm working up a case of dog fever, if I don't have anything obvious on the, in the exam room, on the physical exam, like an abscess or some sort of glaring infection that's right there, then we'll want to do some blood work first and see what the other markers of inflammation are looking like, and see if other organs seem to be affected. Then I often do x-rays to search for a reason, unless I'm, of course, specifically directed towards one area of the body to do an x-ray. And that's kind of our baseline. We'll do a fecal flotation on all dogs with fevers to make sure they don't have any intestinal parasites. Want to make sure they're heartworm negative. And then we often do a urine analysis as well, because having a bladder infection can, of course, cause a fever sometimes as well. But that gives you an idea on fever in dogs and what we look at and what the causes are, possibly could be, and how we diagnostically work them up.